Hello and welcome to EliteHealthOnline.com. Thank you for joining us today. Today we have special guest Sadia Shakit at Texas Star Pharmacy, our compounding pharmacist specialist there. Thank you, Sadia, for being with us.
Sure, I'm glad I'm here.
Awesome. Today we're going to be talking about our pharmacy partner here that has created a really special product, Triple Tex and Longhorn. Really fun names for some special ED products that you guys have compounded there. Little different than the traditional sildenafil, tadalafil that people are used to. Talk to us today, Sadia, about what makes these two products unique and special, and how would they work differently for our patients?
Yes, absolutely. This particular, combination of various ingredients, which includes sildenafil and tadalafil, which are, belong to the class which is called PDE inhibitors, and it's approved by FDA, and it is found in many forms these days to help, with the erectile dysfunction issues.
Mm.
When they are used, and typically they have a lot of localized, results. So if somebody who does not have any brain chemicals involved, and they have issues at the local site, that's where it really helps. But what we have seen, and again, based on the prescriptions we receive and speak with the doctors, and what notice that when we combine it with one amino acid, which is called citrulline, which works very synergistically, and supporting the role of sildenafil by improving nitric oxide, NO, which is a substance that again causes vasodilation, dilates the blood vessels, and improve the blood flow to the localized area. And then there is another herbal agent, which is called yohimbine. And when we combine these two, this three things together between sildenafil and citrulline and yohimbine, the results are not only within 15 to 20 minutes, and on top, they stay a little longer. And then patients usually have a very satisfactory, clinical outcome. So again, this particular combination, we have done it in the form of troches, which are like sublingual use type lozenges.
Mm-hmm.
And the science behind why a tablet would work or a capsule would work versus the oral troches is that anything that is absorbing through sublingual area is getting in the circulation faster. So of course the onset is better than the tablets, because again, tablets or the capsules have to go through the GI, and it can take anywhere between 45 minutes to an hour. That can causes performance anxiety in certain situations as well. So this actually helps overall with the timeliness, plus all the ingredients that are thoughtfully put together to have more of a comprehensive approach.
And Sadia, the troches, every patient needs to be dosed differently. I know there's a lot of research out there that shows that the average male who has ED issues needs a higher dose than what is typically offered. So these come in max dose troches, but that allows for patient adjustment, right? So breaking the troche in half allows you to adjust that therapy based on their experience, because every patient's going to have a different reaction to the medication. So would you talk a little bit about the troche and the flexibility of being able to adjust that dose as you kind of work through what works best for you?
Yes, absolutely. So the troches are actually the dosage form where you can take 4 doses out of one. So let's say if your prescriber is giving you 10 troches, but let's say the first time you're using it, you're splitting into 1/4 and using it, and see how effectively that dose is working for you. It may be just fine, or it may be less, than what you need. So the second time when you need it, you can, of course, can take 1/2 instead of 1/4. And again, depending on that, 10 troches can last you for 40 doses, or it can be 20 doses. And in some who need a lot of, or a lot higher dose, then of course the whole troche can be taken for the right results. But again, it's not recommended to take more than one troche at the same time.
Right.
So
No, no, no,
that's
no, no. You definitely take, only take less than what the prescriber prescribed, but this allows for the flexibility, like you said, to the individual. And we know that that's an important thing because every person responds differently to medication. And no matter how good the provider is, they do not know how you're going to respond to that particular dose. And one school of thought that we have is that it's always best to take the minimal effective dose. So even if you're prescribed an entire troche, if you can take a half and get the desired outcome that you're looking for, that's only going to make the medication last longer and you're taking less of it, which is always a good thing.
Yes, and one thing I also want to make sure here, anytime patients are using medications for ED, more specifically, some call it MSD, which is male sexual dysfunction, different terms. Always make sure that you have a neutralizer or antidote available because uh, patients, if the erections are too long, prolonged, or painful, then they have to have a backup because especially for patients who are initially using it and they don't know how their body is going to react, then when they're seeing the doctor at your practice, then it's better for them to discuss that as an option and have a backup for that. And where it's just to be on the safe side, there are sildenafil and tadalafil, and in combination with these ingredients or without these ingredients, some side effects are possible, which can include, irritability, headache, a little bit of nausea. And some who have used just the sildenafil, they can always talk about having a little stuffy or runny nose afterwards. This is and these are on their package insert, the commercially available tablet form or the capsule form. So it's better that we are aware that, oh, I'm having that little bit of, congestion. It is anticipated with this medication because this is how the vasodilatory part of it works. The mechanism works actually.
Well, Sadia, this is super helpful. Thank you for being with us. Again, nothing on today's conversation is meant to be used to treat or to diagnose a condition. You'll need to visit us. Please click the link, come talk to us. We're happy to help you if you're suffering from any of these issues. We have some phenomenal therapies available for you. They're very affordable, easy to order. And again, the compounding pharmacy that we use here has created some special products that I think will work really, really well. Compared to kind of your traditional sildenafil and tadalafil. So please visit us today, and thank you for joining us.
Thank you.